Defining death and life-death issues. As technology has become more advanced, determining what counts as death has become more complex as well. Once upon a time, the signs of death were more straightforward. No breathing, no heartbeat, and the body becoming rigid as rigor mortis set in. Now, however, we have machines that keep the basic biological systems moving even though the entire brain except for the brainstem have stopped producing electrical activity. The brain's lower portions monitor heart rate and respiration, so all of a person's higher brain functions could be irreversibly gone, but they might continue breathing and have a heartbeat. So there's some disagreement about when to consider a person to be dead. Currently, the definition of brain death that most physicians follow includes irreversible death of both the higher cortical functions and the lower brainstem functions. Some medical experts, however, argue that the criteria for death should include only higher cortical functions. The functions of the brain that we associate with being human, such as intelligence and personality, are in the higher cortical part of the brain. If that's dead, then the person might be technically alive in the most rudimentary sense, but functionally that person is gone. Advanced care planning refers to the process of thinking about and communicating your preferences for end-of-life care. If you're in a coma and can't communicate your wishes with hospital staff, so other people have to make your medical choices for you, you want to have some advanced planning in place. It's important to write down and communicate these preferences ahead of time regarding whether you want to be kept alive in certain scenarios and when or whether you want life-sustaining treatments to be administered. If the only thing left of your mind is the brainstem, do you want to be kept on machines indefinitely without hope of recovery, or do you prefer for them to stop care and let you die? This would be an example of passive euthanasia, when a person is allowed to die by withholding treatment such as turning off a respirator or heart-lung machine. By contrast, active euthanasia is when death is deliberately induced by a third party by administering a lethal dose of a drug. This is a very controversial practice, and each state is allowed to have its own policy on whether active euthanasia is allowed. It's controversial because a lot of people consider this to be murder. One alternative is assisted suicide, where a physician supplies the information and means, but the patient themselves administers it. This would be a situation where the person has a terminal illness and wants to be able to decide the timing of their death. When they reach a point that their level of suffering is too great and their quality of life has dropped to a certain level, they can choose to go at that time and on their own terms rather than to continue suffering needlessly. Because death in America is too often a lonely, prolonged, and painful process, care providers are increasingly interested in helping individuals experience a quote-unquote good death. This is most commonly characterized by making the end of life as free from pain, anxiety, and depression as possible. Hospice programs are programs committed to providing this as much as possible. Whereas hospitals exist to cure illness or prolong life, hospices emphasize palliative care. Palliative care is focused on reducing pain and suffering and helping individuals die with dignity. The majority of hospice care is provided in patients' homes, but there are some, freestanding full-service hospital facilities. Also, hospitals are starting to expand their provision of palliative care for those who want it. With the baby boom generation now in late adulthood, there's a growing need for home health aides in hospice and palliative care facilities.